Hi, my name is Andy. I'm one of the nurses here at Population Health at Union Hospital. Just wanted to take a few moments to talk about congestive heart failure, particularly in the SNF setting. Luckily, I know exactly where you've been. I've worked as a CNA, I've worked as a clinical nurse educator, and a director of nursing, so I'm very familiar with the circumstances and the environment in which you work every day. Congestive heart failure is one of our top readmission diagnoses, and we wanted an opportunity to help educate you a little bit more, or maybe just refresh some skill sets. Talking about the signs and symptoms that can be experienced with congestive heart failure. Talked about shortness of breath. Something that can often happen is what's called orthopnea. That may be when a patient experiences shortness of breath in a laying position. If it happens at night, that's often called P&D, or paroxysmal nocturnal dyspnea. Often happens 1 to 2 hours after a patient is laid down in a flat position. They may abruptly wake up due to the shortness of breath. The best thing that we can do in a nursing home facility at that moment is what? It's elevate the head of the bed, help prop the patient up. A lot of patients, you'll notice with congestive heart failure, prefer to sleep in a recliner, and it's for that very reason. It's to help elevate and cause that fluid to shift and not be congested up along, where the fluid can evenly be dispersed in a laying position. Talking about lower extremity edema. Most patients with a congestive heart failure diagnosis will experience some form of edema at one point or another. For some, baseline might be 1+ pitting edema. They may have a certain level of fluid that is constantly built up in their lower extremities. That is the easiest place to assess. For some, we might have to look at maybe doing an abdominal girth to check for ascites along the abdomen. In the SNF setting, we often have to get creative about our assessment skills, as consistency is always key. If a patient experiences increased edema, maybe you start noticing that when they sit up it's now 2+, 3+, or 4+ pitting edema, that's the time in which to take action. It's getting familiar with your patient to know where do they come in and what is their typical baseline versus watching those symptoms slowly progress. The faster we can catch those symptoms, the faster we're able to contact cardiology or a primary care physician. In your case, it could be your medical director to help get interventions in place. Interventions may include everything from increasing diuretic usage, might need to have short-term application of oxygen depending on what their saturation levels are, where that congestion is taking place if it's happening in the lungs. Some of the other symptoms that you might notice or you could kind of assess for in the SNF setting would be something like jugular vein distension. You have the head of the bed at a 45-degree angle and you notice that the veins are distended, especially along the right side of the neck. That again is a very small indicator that we could be entering an exacerbation of CHF. One of the other assessments we often do, and the nurses should be doing this hopefully on a daily basis, is auscultation of lung sounds. Lung sounds can vary depending on the form of congestive heart failure that the patient has, from wheezing to potentially rales or crackles. Again, this is maybe an indication that we're starting to have that fluid build up into the lungs, causing that congestion. One of the other things that's a key, very, very key and super important, and I know it's kind of one of those dreaded things, unfortunately, in the skilled nursing facility, is the daily weights. Daily weights are essential. It can be a very quick indication if a patient is having that increased fluid retention. Daily weights are most important with consistency. Consistency is everything when talking about a daily weight. Consistency in the type of clothing that a patient wears. Did you know that a patient or an average pair of shoes weighs 2.5 to 3 pounds? That 2.5 to 3 pounds is often what classifies as a reweight for that skilled nursing facility, and nobody likes to do the reweights. But other things to consider is the DME. Does the patient have a wound vac? Did they have a wound vac at the initial assessment of their weight? Has the wound vac been discontinued and they no longer have that equipment? Is it being detached prior to collecting that weight? What about the type of DME that they're getting weighed in? Is it the standard wheelchair of the facility? Was it the patient's own rollator or standard walker? Does the patient have a Foley catheter? How much urine is in that Foley catheter bag or a leg bag? That can all be factors that could vary the weight of a patient. I know with nutritional assessment reviews, those meetings that we have on a weekly basis to talk about those factors, weight is a big point of topic, but then that leads us right into diet, low sodium diets, monitoring the patient's food intakes and snacks, and having moments of education on what is appropriate or inappropriate as their meal selections or for the snacks that they have at bedside. This could also be linked to fluid restrictions. fluid restrictions are extremely hard, but super important, especially in those patients that have later stages of the CHF diagnosis. Keep in mind that CHF is a progressive and chronic disease process. It is not something that will ever be cured or ever be resolved, but it certainly plays a role in all of the other body systems. If we can work together by identifying these signs and symptoms, being able to take action early and put things in place, hopefully we can help our patients have a better outcome, a better quality of life, and work in collaboration, because as we work together, we are healthier together. Thanks for taking the time to watch this video and seeking out an opportunity to further gain knowledge and hopefully improve or regain some confidence in your assessment skills. Keep in mind those CNAs are your best friends, as they do get to know the patient to a different level. They see them every day and for majority of the day, and can be great at reporting those early signs and symptoms of CHF.